Hey, I'm Dr. Procter with Beltline Health here in Atlanta, Georgia. Today we are going to talk a little bit about revision surgery. This is something that we get a lot of calls about, weight loss revision surgery in particular. So our goal with all of our patients is for them to understand before they ever make it to the operating room that these operations create a physiologic reset with the body. Everybody's been through these yo-yo diets where they'll see some weight loss, have the weight come back over and over again. The intent of bariatric surgery is to help you lose that weight permanently. The surgery is required to create a metabolic response in the body to help the body want to lose that weight. Now, that in and of itself, without an overall lifestyle change, unfortunately, isn't going to be lasting. A lot of patients aren't educated on this preoperatively or forget about it down the road, start slipping into some bad habits later on down the road after their surgery, and guess what? It doesn't take a lot of food with our food supply to take in too many calories and start seeing your weight drifting back up. When that happens past a certain point, you wake up one day, your body mass index is 40 or higher, and you're back in the need of having weight loss surgery in order to get your weight back down to a safe number. That's where we start talking about revision surgery. When patients come into our practice to talk about this, we will generally put them through what we call a 6-month weight regain program, which involves visits with our dietitian to get their diet back on track, visits with the bariatric psychologist to sort of help them see through any emotional reasons why they might have been gaining too much weight. We'll certainly do some imaging with regards to endoscopy and radiographic images to make sure that the anatomy of their bariatric surgery is still intact and nothing has changed there. And we'll try to do everything we can for that patient to get the weight back off of them without surgery. Now, depending on how much weight they've regained, that's not always possible. And if we're not able to get a substantial jump in their weight loss, then that's when we sit down and we start talking in earnest about what are the various types of revisions you can have. Now, the most popular operation that we've seen over the last 10 years is the sleeve gastrectomy. It's popular because it's an effective operation. It's a fairly quick operation to do, and a lot of places it's being done almost as an outpatient procedure. It will remain effective for the patient as long as their diet stays in check. Unfortunately, that doesn't always happen. And with this particular operation, because we're not doing any type of small bowel bypass, patients are going to absorb everything that they eat. So if you start getting into some bad habits, you start having some high calorie food or beverages, you're going to see some weight regain occur over the road. Now, the advantage of a sleeve gastrectomy is that it's a very easy operation to convert to a different bariatric procedure. We can easily convert a sleeve gastrectomy to a gastric bypass, a mini gastric bypass, a duodenal switch, a single anastomosis, or SOTI duodenal switch as well. So it's a very convertible operation and one that doesn't take too much to do it very safely. Problems come in when patients have things like gastric bypass or duodenal switch who have weight regain. Now, luckily, it's not as common with those procedures, but it does happen. We do a fair number of gastric bypass reversals to duodenal switch in our practice for patients who have had significant weight gain. Again, we try to do everything we can with these patients preoperatively to try to help them avoid going back to the operating room. But when those things don't work, we can reverse this procedure to something else. There's been a number of different procedures that have come along to try to squeeze a little bit more weight loss out of the gastric bypass. None of them are great options. None of them are very easy to do, and they're all very complex operations. But when they need to be done, you want to visit a surgeon such as Mike Blaney or myself here in the Georgia area who've done quite a few of these and can get you through this operation in a safe manner. If you'd like to hear more about this, please feel free to contact our office. The link is down below. Please tune in for some more content later.